start with what made you want to become a doctor in the first place? What was your, your inspiration or motivation behind that?
Oh, wow. Well, first of all, Taylor, thank you so much for having me on your podcast. I've been following you for a long time. I learn a lot from you. You inspire me to do more and to focus more on nutrition in order to help my patients. So thank you for all you do.
Well, thank you.
I'd love to tell you that there's some, incredibly inspiring story of wanting to help people, and that's why I became a doctor. But it's nothing like that at all. My father is a physician, so I grew up knowing that. I have an older brother that's 2 years older than me. He followed in my dad's footsteps and wanted to be a doctor. I was, believe it or not, quite the introvert and followed my brother around. And so I just headed in that direction, not really knowing what I wanted to do. So he applied to be a biology major undergraduate. We both went to USC. And then he applied to medical school, and I did the same because I didn't really know what else I was going to do. Okay. So it wasn't really until I was about 2/3 of the way through medical school that I now had to choose the specialty in which I wanted to practice, that it kind of hit me that I better figure this out because this is actually what I'm going to do for a living.
Yeah.
So I spent a lot of time in various specialties trying to figure out what I wanted to do. And believe it or not, I thought I wanted to be a psychiatrist.
Oh, wow.
What better field than giving back somebody the essence of what it is to be a human being, to be able to communicate, to feel good, etc. But I soon learned that mostly, not all psychiatrists, but mostly what psychiatrists do is they simply prescribe medication. It's a 15-minute visit to see how you're feeling, you adjust the medication, and then you see them back in a few months. And I didn't want that, and I knew if I went into psychiatry, I would soon need psychiatric drugs myself. So I didn't want to do that. I thought maybe an orthopedic surgeon because I was an athlete growing up, but I'm not particularly handy. I can barely change a light bulb, and what I realized is orthopedic surgeons are very handy, and they use all kinds of power tools, putting people back together again. They stand on their feet for long hours in the operating room. I hate doing that. My feet hurt like no tomorrow. I remember in the operating room, I would wear thigh-high support stockings because my feet hurt so bad, and I would take a handful of Advil before I went into the operating room because it was miserable standing there for sometimes 4, 5, 6 hours at a time.
Yeah, that's a long time.
So I stumbled across family practice because it was natural for me. You could do what you want to do. You could refer if there were areas that you weren't comfortable in seeing patients, and it was natural. So I went into family practice and went into, did a family practice residency at UC Irvine, which is where I also went to medical school. And I see over your right shoulder, you have the cutest dog ever. I don't know who that is, but.
Yes, that's Nash. So sometimes they pop in.
Oh, that is funny.
Yeah.
So, listen, I love what I do. I feel very blessed that most people don't enjoy their work. Most people go to work because they want a paycheck. And so my purpose in life and my occupation are in alignment perfectly for me. I've also, of late, realized that my relationship with God is growing and super important. And so I've tried to incorporate that into what I do on social media and my clinical practice. So I feel very blessed that my job also is partly my purpose in life, and so that's why I do what I do.
That's awesome. Well, that's great. Even though that's not like you said, it may not be the most inspiring, but I still think that is because it kind of led you to ultimately do family practice like you're doing.
Sure, absolutely.
That's awesome. So obviously now you're pretty vocal about speaking out against different things in the medical field that maybe are a little bit more on the corrupt side. I know like during COVID you were really vocal. What was kind of your light bulb moment to be like, okay, I think I should change my approach to how I'm practicing medicine?
Well, there are really two things. One is during COVID, I, like everybody, was overwhelmed, and groceries outside your front door, spraying things down with Lysol. We were told to shelter in place and not leave the house. And it took a couple weeks. And then I realized this just doesn't make sense. It doesn't make sense. We're talking about a coronavirus, which is incredibly common, the most common cause of the common cold. And we're telling healthy people to stay inside. We've never done that before. We were closing down places of business, but allowing big box shops like Costco and the like to stay open. We told churches and temples and places of worship that they could no longer do that. We've never done that before in our country's history, a complete violation of our First Amendment rights. But we allowed marijuana dispensaries, liquor stores, Planned Parenthood to remain open.
Yeah.
And it didn't take long. I'm like, what is going on here? There's something amiss. This is not right. And about the same time, I needed a new medical assistant working in my office. And I think through divine intervention, Stephanie, who still works for me on social media, came to work for me because she was fired after an 18-year career at Kaiser because she refused the COVID vaccine and she refused to be tested. So not long after she came to work for me, she started questioning everything I did. Like, why are you giving this person antibiotics after they've been ill for only a day or two? Have you read the package insert for the childhood vaccine that you're about to give this kid? And she really pushed me to do my own research and to question all the assumptions I had and question all the things that I was learned in medical school. And that really started me on this journey of looking into holistic health and taking a second look at things that I thought was true, turns out isn't true. I am convinced most of the things I was taught in medical school are false, such as statins are the path forward to prevent cardiovascular disease. Putting women on birth control pills is a good thing and a healthy thing to do. Vaccinating kids against illnesses that are not even high risk without even reading the package insert or giving them informed consent is something we should continue to do, and on and on and on. And I had this awakening really as a result of COVID. So there is a silver lining to COVID.
Yeah.
And I started questioning everything. I mean, I don't know how personal you want to get, but you came into my life as well during this time, and I really pushed you to do things differently as well. And I have now learned so much from you and your nutrition and your healthy living and your lifestyle as well. And so it's the craziest thing ever that we have this platform called Instagram that my daughter really pushed me to start.
Yeah.
One day, I think it was even before COVID, she calls me Pop. She said, Pop, you should create an Instagram account. I'm like, all right, Allie, I'll do that. And she came up with the name RX for Liberty. I said, great, what is Instagram exactly? She goes, well, it's sort of like Facebook, but only for pictures. I'm like, whatever, go ahead and create the account for me. And 200,000 plus followers and subscribers later, I'm realizing I'm learning more from social media influencers on Instagram than I am often from traditional doctors now. And there are so many good people on Instagram, from Peter Attia that's there, to Gary Brecka, to Andrew Huberman, to Paul Saladino, and on and on and on. People that have been given this platform. And now, fortunately, we're seeing less suppression of free speech on Instagram and Facebook. So I think it's a wonderful platform for people to learn. They're going to use their phones, which I think is pretty unhealthy anyways. At least they can use their phones to learn something. And if you're watching this as one of my followers and subscribers, and you don't follow Taylor, please do so, because she is an incredible wealth of holistic knowledge. So you should definitely learn from her.
Well, thank you. Yeah, so you touched on a few things, which are all things that I do want to talk about today. I guess I'm like, where to start? So yeah, COVID was kind of your light bulb moment, which I think was a light bulb moment for a lot of people. Everyone didn't really question the government too much or things that we were told to do. And then as COVID started to drag out, it was like, wait a minute, why are we still like locked down? Why are we still, social distancing? It didn't make sense, especially too, as like many people got it and were fine, weren't that sick. They got over it just fine, especially if you didn't have any comorbidities or anything like that. So I was kind of in the same boat as you. I kind of really woke up from COVID. Granted, I was always a little bit more into holistic health, but I still was like, I didn't really question vaccines or anything like that. And then once COVID came around, I was like, wait a minute, none of this is adding up. So, I guess let's start with birth control, because when I had recovered from my Lyme disease and everything, but I was still struggling with my skin a little bit, and I had the copper IUD because I couldn't take hormonal birth control because I have factor 5. And you had said to me, you're doing all these things for your health that's like natural and holistic, yet you still have the IUD, like take it out. And I was like, I know you're right, like I need to take it out. And sure enough, like that made such a huge difference. So
Yeah, for sure.
what is so problematic about birth control? Why do doctors so freely push it on women if they're having painful periods or, acne or whatever the case is?
Sure.
Band-aid for.
Yeah, we're taught things in medical school that simply aren't so. And birth control pills are incredibly unhealthy. They're not natural. They're tricking the female body to pretend like they're pregnant. And I truly believe in most cases, whether it's painful periods, irregular periods, skin conditions, acne, etc., those are all symptoms. Those aren't a disease that need to be cured. They are a symptom of something else. Now, we can't always get to the root cause, but we should certainly try. And what birth control pills are doing is they are simply treating and masking the symptom. They are not treating the underlying root cause. And I've just seen it too often. Birth control pills cause all kinds of problems, including mental health problems, including fertility issues, hormonal issues, of course. As a matter of fact, I read this article once, Taylor, that said when a woman is on a birth control pill, they are likely to choose a partner, to choose a man with a very different personality than what they might otherwise choose because of the effect of the birth control pills on their hormonal access, on their mental health, etc. Then at some point they want to go off birth control pills to get pregnant, and they slowly revert back to whatever their baseline personality and mental health status is, and all of a sudden they're looking at their partner across the table and going, holy crap, I can't believe I chose this guy. I chose this guy because I was basically being, I don't know, intoxicated or affected by this hormonal pill that was in me, and this isn't actually who I am. Not to mention that there are oftentimes incredible infertility problems once you go off birth control pills, waiting for your body to revert back to whatever the baseline is. So I think a much better approach is to try to understand whatever symptoms a woman has that you're trying to address and get to the root cause of why you're having that. It's often stress, it's often poor sleep, it's often gut health, it's often terrible nutrition. And so, the question is, well, you've got, a 20, 25, 30-year-old that doesn't want to get pregnant that's in a relationship. And I think that's an important consideration, but here's the reality. A woman is really only able to get pregnant for about a 5 to 6 day window in their cycle anyways.
Yep.
And if you're responsible and you measure certain body metrics, basal body temperature, cervical mucus quality, of course, when your period is, etc. If you measure about a half a dozen metrics and carefully track your period, and there's apps to do this, the chances of getting pregnant are almost equivalent of that if you were on a birth control pill. Then you can layer in some non-hormonal birth control mechanisms. There's this product, as a matter of fact, a gynecologist at Hoag, who's one of us, who's a hardcore unvaccinated patriot, shared this with me. There's a product called, I think it's called Plexus, and it's a vaginal cream that you use. It's non-hormonal, that can be fantastic at also helping to prevent pregnancy. So I think there are mechanisms to prevent pregnancy that are almost as equal to birth control pills without the downside. So I no longer prescribe birth control pills for women.
That's awesome.
I just don't do it. I'll have a conversation with them both about how to prevent pregnancy, how to clear up acne, how to regulate your periods. I'll send these folks to you because you're smarter than I am about nutrition, even though you're a vegetarian, which I don't agree with, but I still love you. And I think you're great at especially working with women with hormonal imbalances and so forth, treating gut health, using nutrition as a tool for medicine. This is one of the changes. I used to routinely, a teenager would come in and they have irregular periods. I'd write a prescription for orthonovum, whatever. Somebody who doesn't want to get pregnant and they're in a relationship, I'd write a prescription.
Yeah.
I don't think that's the right approach to medicine anymore. I mean, I guess I could imagine a very rare situation where hormonal products would benefit women, but I just don't think overall that it's a good way to approach irregular periods, dysmenorrhea, skin problems, etc.
Yeah, absolutely. Well, it's funny you mentioned how it changes like who you're attracted to. There's a book called "This Is Your Brain on Birth Control," and it talks about all the ways birth control literally changes the female brain, and it does. It changes who you're attracted to. You don't pick up on subtle pheromones of a possible partner that you would pick up on if you weren't on birth control, and it's crazy how it literally changes the person that you are as a woman, being on it versus off of it. And hearing people talk about their stories coming off of hormonal birth control and like rediscovering who they are and different interests that they have. It's wild. I mean, I've never been on birth control, so I can't compare, but
well, I remember when you came in, you mentioned the copper IUD. I wasn't going to share your story, but I know we were struggling with some skin issues you were having, and we were scratching our head, trying to figure it out, looking at whatever topical creams and so forth. And I don't know how it came up that you shared that with me, that you had a copper IUD. And I'm like, I don't know that this is it, but it's just so unhealthy to have foreign bodies inside of you. I have more women now that are doing explanting. They've had breast implants, are having them removed, and they feel so much better. There's just a whole litany of symptoms that they have, and as a result of being explanted, they just feel so much better. Our bodies were created perfectly. That's my belief. And if we just create a mechanism by which we take care of them in a holistic way, they're designed to heal. And when we put foreign bodies inside ourselves, be it breast implants or IUDs, etc., our body knows that there's something up, and they are fighting to reject that. And it's just not healthy for us. And your skin, by the way, looks gorgeous now. And so to whatever extent removing that IUD helped, I am thrilled for you.
Thank you.
I heard Brian Ardis talk about this. Brian Ardis is this chiropractor that I followed. He's talked about snake venom, and he's talked about remdesivir and how horrible it is. And I can't quite decide whether he's a genius or he's crazy, maybe a little bit of both. But he uses this example, and he says, we all know somebody that's had a transplant, kidney transplant, lung transplant, heart transplant, whatever. We all know people like that, and they need it for a variety of reasons. One of the first things they do when you come out of recovery after you've had a kidney transplant or some other kind of transplant is they put you on massive anti-rejection drugs so your body doesn't reject the organ that you just had transplanted. Because now you have, typically you have a human donor, but you have foreign DNA inside of you, and your body says, wow, what is this? We don't want it in us, and we're going to work hard to get rid of it. So that's why you have to be on transplant drugs the rest of your life. Now, if we translate that into vaccines, for example, all vaccines are grown in some sort of tissue. It could be chick embryo. In certain cases, it's even aborted fetal cells, etc. But you are injecting foreign DNA into your body. And so it's no wonder that many people have a severe reaction to these vaccines, because your body is seeing foreign proteins, whether it's chick embryos or human embryos or even plant-based DNA products or whatever it is. It's seeing this DNA that's not yours, and it wants to reject it. So whether you have a foreign body inside of you in the form of an IUD, breast implants, or whatever you have, I mean, even joint replacement surgery, and I'm not telling you shouldn't have joint replacement surgery. Sometimes it's necessary, and you have titanium or whatever it is in you. You need to be very careful, because the body understands that what's inside of you isn't supposed to be there, and in certain cases can cause a lot of inflammation. Yeah. And so you just got to be careful. And I always want my patients to live as holistically as they can, as pharma-free as they can. And learn how to take care of themselves by enjoying nature, eating super clean, grounding, getting plenty of sunshine, and allowing their bodies to use their God-given healing powers to be their best.
Yeah, definitely. You make such a good point about it's a foreign entity in your body. And even with the IUDs, the copper one, it's wrapped in plastic. So not only do you have like the metal, but then you have plastic in your body, and that's not great hormonally either.
Oh, for sure.
Yeah.
Yeah,
Well,
absolutely.
since you touched on vaccines, if you want to, let's talk a little bit about vaccines. What a lot of people don't realize when people start to be like, oh, you're anti-vax, so you're this, it's like, it's not that radical because all you have to do is read the package insert and you start to realize that there's a lot of holes in vaccines, whether it be the COVID vaccine or some of the childhood vaccines. And then when you look at childhood vaccines, a lot of them, they, like, I think the Hep B vaccine, it was tested for what, 5 days or something like that, and a lot of them don't have like a control group, and so then it's like, how safe and effective are they really? um,
That's right. And I, recently wrote a book about vaccines, Unavoidably Unsafe: Childhood Vaccines Reconsidered. It's available on Amazon or wherever you buy books. Yeah, I've really come around on vaccines. I used to give them out routinely. Somebody came in and wanted a flu shot, no problem. You want a COVID vaccine? Yeah, whatever. Shingles vaccine, pneumonia vaccine, childhood vaccine schedule, et cetera, is like, yeah, whatever, safe and effective. Have at it. Take a little Tylenol. Have a nice day. I've completely changed my mind. I will no longer recommend vaccines to people. I don't think they're either safe nor effective. Many of the vaccines are preventing benign, otherwise harmless illnesses, like chickenpox, for example. When I was a kid, I had chickenpox, the actual disease. And
yeah.
the reason why I had chickenpox is my mom dragged myself and my brother down the street to a kid that had chickenpox, exposed us. Yeah, we were home for a week or two with chickenpox, calamine lotion and oatmeal baths and so forth, and we recovered. I still have chickenpox, positive chickenpox varicella titers in my blood. So many of these childhood illnesses are benign, and the vaccines aren't benign. They
Yeah.
often have aluminum as an adjuvant. An adjuvant is a chemical that forces our immune system to wake up against whatever the vaccine is. Aluminum is a neurotoxin. It's not healthy to be injected. There are a lot of people that will say, there's a New York Times article floating around on social media that talked about that aluminum is present in many things that we consume and it's not unhealthy.
Oh, I saw that. Yeah.
The difference is the aluminum that we consume that's in nature, it's in very low dose, it goes through our GI system, it gets detoxified, versus the aluminum that's in vaccines are injected directly into our muscle, goes right into our bloodstream, passes the blood-brain barrier, gets into our brain. It is very unhealthy. If it was one dose, maybe, but we give kids 70 doses before they make it to high school of these various vaccines. This year's flu shot, for example, they reintroduced thimerosal. Thimerosal is a mercury-derived preservative. So in the multi-dose vials of flu shot that hospitals and pharmacies all use, it has thimerosal. Why would you purposely put a neurotoxin like mercury directly into your muscle? It's crazy. It's crazy that we're doing that. Never mind that it doesn't actually work.
Yeah.
And never mind, I don't want anybody to get the flu, but the flu is a relatively benign illness that your body can fight off if you support your immune system with good nutrition, handful of supplements, etc. So we're going about this all wrong. We are scaring people into treatments that they don't need. We are putting products into their bodies that are unhealthy and in many cases can harm them. And I won't play that game anymore. And you can call me an anti-vaxxer if you want. But what I want is informed consent. I want people to understand what is in the product, what are the studies that brought it to market. And by the way, not a single childhood vaccine was tested in a randomized controlled trial against a placebo, an inert placebo. None of them has been tested that way. The FDA requires a very different level of scrutiny for vaccines as they do for drugs that are brought on the market. And I just want it all revisited. Maybe there are some safe vaccines. Maybe we need to redo some of the safety studies. Maybe we need to create new products that actually are safe and effective, but right now they simply don't exist.
Yeah, definitely. And yeah, what happened to kind of like natural immunity being so great? Because like you said, with chickenpox, I remember being young and my cousins had it, and so my mom and my aunt got all of us together and we all kind of had chickenpox at the same time. I feel like measles was a little bit like that. I know on social media it's been circulating this episode of the Brady Bunch when they all had the measles and they were like not worried
Right.
about it. And I didn't even know that about measles so much because that was a little bit before my time. But it's crazy that that all of this fear that has been, instilled in parents and just in people to be like, yeah, you don't actually want to get this illness, so you might as well just get the vaccine, when it's like, let your body get sick, let your immune system get stronger as a result of that. And, you know, as time goes on, you'll be a healthier person from having had that.
Oh, I completely agree. And the same thing with foods. You had a post recently where you said there's something like over 10,000 food additives that are approved in the United States. Compare that to Europe, they only have a handful that are allowed. They ban many of the things that we allow here in the United States. Why do we do that? I mean, listen, I don't really want the government to get involved in banning this or banning that. I want individuals to learn how to optimize their own health. I want them to read labels. I want them to understand when it says, food dyes are in the product, that you shouldn't be eating that. Why do we need food dyes anyways? They're not healthy for us. I know the FDA just banned, I don't even remember, blue dye, yellow dye, whatever it is. I don't care.
Yeah.
I don't care that the FDA is banning something. I care that that people need to learn how to read food labels and
Yeah.
how to make better decisions about their health. The big picture overview that I describe for people is, I want you to eat food that God made, not that man made. And if you think about it that way, and you grab a packaged good at the supermarket, that's not a that's not a God-made product, that's a man-made product. And when there's ingredients in it that you can't even pronounce, me included, and I've been doing this for a long time, and I read food labels, I go, I don't even know what that is, and I can't pronounce it. I'm not putting it into my body. So eating, I know you and I disagree about this, but eating healthy meat, hormone-free, antibiotic-free. If you know a rancher, you can get it that's vaccine-free, grass-fed, grass-finished products, whether it's cows or bison or elk or whatever I think is healthy.
Yeah.
Organic produce only. There is, when you're not eating organic, even though the organic labels are not perfect, I get it. There's some confusion about organic. I understand that. But nonetheless, if you're not eating organic, your food is likely sprayed with some sort of pesticide like glyphosates. That's terribly unhealthy.
Yeah.
Now, Bill Gates has this product called Apeel, A-P-E-E-L. It's this synthetic plastic coating that goes over fruits that is supposed to make it shelf life much longer. You can't wash it off. It's incredibly unhealthy. It's like eating microplastics directly.
Yeah.
So you got to look. They're supposed to put these labels on the food. They don't always. You got to talk to your grocer or go to a holistic market. I'm lucky. I've got a farmer's market real near me here in Corona del Mar. So most Saturdays I go down to a farmer's market. There's a produce guy that I've gotten to know. He describes how he grows his produce. He has wonderful produce, only seasonal stuff.
Yeah.
I don't buy produce that's imported from across the world that's been sitting on a container ship forever. And same thing, the egg lady. So there's a recent article about Vital Farms that everybody thought was like the healthiest, most wonderful produce, most wonderful eggs ever. And they kind of got busted for their claims of pasture-raised organic wasn't actually true. So there's a chicken lady at the farmer's market. She actually raises the chickens herself, and she tells me what she feeds them, and she never uses hormones or antibiotics. And she shows me pictures of her farm, and her eggs are wonderful, and they're filled with chicken poop, and they're not even washed first, so they last forever. So that's where I try to buy my produce, where I try to buy my meat. There's a meat guy there, and vegetables and so forth. So if you can find a farmer's market near you, get to know the people that actually grow the products, or grow them yourself. If you're lucky and you have enough land, start growing food again. We used to do that 100 years ago, where we'd grow our own food. Now I forget less than 1% of people actually grow their own food. Ultimately, we should get back to that.
Yeah, definitely. I totally agree. Most people wouldn't know how to grow their own food if they had to in a situation, and I think it is a skill that people should learn. And yeah, it's funny. I was talking about this on my last episode when I had my uncle, who's a dairy farmer, on, because obviously we do disagree a little bit as far as nutritionally. He eats meat. He obviously eats dairy products and stuff, and I don't. But my view on, there's such a divide between plant-based and meat-based, and, I have clients who eat meat, and I usually recommend them to eat grass-fed beef over something like chicken or anything like that.
Sure.
But I look at it very spiritually, because, there's the argument that, if you don't eat meat, you can never be healthy. But I don't think that God would have put humans here on Earth to where they only had to eat one type of way to be healthy. The only way to be healthy is by eating eating meat and animal products, that I think like he would have designed us to be like, well, if you don't want to eat animals or animal products, like you can still eat plants and be healthy. So I don't think there's like this one way that is the only way to eat to be fully healthy. I do think, plant-based versus meat-based both can be equally healthy. Obviously, you can be plant-based and be super unhealthy, eating beyond
Sure.
meat, possible burgers and things. But I think too, it boils down to the individual. And I've also seen in my practice that men and women are also very, very different. Women usually fare better or prefer being on a no meat diet. Men usually feel like they need meat in their diet and typically function better. And so I do think there's this slight difference between men and women. I also think when you go back, like historically, men were the hunters, women were the gatherers, women also were are the life givers. And so I feel like women subconsciously maybe have this aversion to eating dead animals just because they're the ones who bear new life. And so I've like really reflected on this, on why is it that you see more often than not women being the ones that, oh, I'm fine without meat, like I don't need it, I feel great without it. So
Yeah, no, I agree with you. I think there are a lot of differences. What I tell my patients is if you feel really good most of the time, you probably don't need to change much from your nutrition standpoint. But the problem is, at least people that come to me, they don't feel good. And when you break down their diet, it's filled with garbage. I think the number one mistake we all make is too much sugar.
oh
And
yeah.
sugar is very toxic, and it's in everything if you don't read the labels. The second is dehydration, and the water they drink often is not good. Tap water,
Yeah.
in my opinion, should be described as government water. It's poisonous, not literally, but figuratively, because it's got chlorine and fluoride and heavy metals, and we're relying on the government to tell us what safe level of these products are good for us. So
And it has trace pharmaceuticals in it. Like there's like remnants of birth control in tap water because they can't filter it out.
100%. So ideally, even if you just buy a cheap filter at Target or whatever, one of those pitcher filters like Zero Water or Brita or whatever, that's much better than drinking the tap water.
Yeah.
Ideally, you'd get some sort of reverse osmosis system. That's what I have. And then you also have to think about the water that you shower or bathe in.
Yeah.
Because if you're standing in a nice warm shower in the morning and your pores are opening up and you're bathing yourself in chlorinated, fluoridated water, that's not good for you either. I remember, I think it was Gary Brecka did this experiment where he took 2 glasses of tap water and he had a friend stick his hand in one of the glasses for about 5 minutes. Then he ran over to a pool supply store and got a chlorine test strip. And he tested both waters. The water that had the hand in it had 0 chlorine in it. The water that didn't have the hand in it, there was just tap water, had a ton of chlorine in it, just to show you that your skin readily absorbs whatever is in your water that you're bathing or showering in.
Yeah.
So I've got a shower filter, so I'm not, showering in chlorine water. And I try never to drink tap water. Even when I go out to dinner or go out to eat, I always ask for the bottled water, not the tap water.
Yeah. Yeah, water's such a huge one, and people don't realize that our skin does absorb it, and we spend a lot of time showering and letting it touch our skin, so it's just as important as not drinking it.
So Taylor, you mentioned in one of your posts, and I agree with you, although I don't have the knowledge that you do. And your post goes something like this: ladies, stop modeling your health after men's health. You function entirely different. You need more sleep than men. You can't tolerate fasting as well as men. You aren't as stress resilient as a man. How sexist of you. And stop trying to keep up with their 24-hour hormone cycle when you have a 28-day hormone cycle. So what do you mean by all that?
Yeah, so I mean, it's first of all, and you may know this too, a lot of research about health trends or different, nutritional stuff is usually done with men because they're a little bit easier to study. Their hormones are a bit more predictable. With women, your results are going to be all over because our hormones are a little bit all over. So it's easier to study men. So when you get these results, like let's take ice baths, for example. Most of the research on the benefits of ice baths have been done on men. They haven't been done on women. And a lot of times ice baths are more stressful for a female body. Again, we aren't as stress resilient, and depending where we're at in our cycle, it could be problematic. Like if you're a woman and you really want to do ice baths, you should do that more in your follicular phase. Don't do it in your luteal phase or when you're menstruating. That could be really detrimental. And so a lot of times women will read things like, oh, this is good for you, not realizing, well, they actually haven't really studied that on women. They've only studied it on men. So it's good for men, but it might be good for women, but you should take it with a grain of salt. And, you know, it's easy to want to do the trendy thing as a woman because you do think it's good, but you do need to be aware that this might not be good for you. And if it doesn't make you feel well, don't feel like you have failed as a person because ice baths made you sick or something. Nothing is wrong with you. It's just you are a woman and you are taking some type of result that was looked at only on men.
100%. The same thing is true with pharmaceutical products.
Yeah.
Almost all the studies are done on men, not on women. And we are very different creatures. Intermittent fasting that has been so popular, I don't know that that's a good thing for everybody to be doing. And it's not a good thing if you're relatively normal weight and you're a woman. I don't know that that's a healthy thing to do. Of course, you know, experiment with different things and see what makes you feel good. But whether it's cold plunges or intermittent fasting, be careful.
Yeah.
You know, play around with these things for sure, but don't assume that it's going to be healthy for you just because it's the latest trend. You know, some Instagram influencer is recommending it and selling it. Don't assume that that's what's going to be best for you.
Exactly. And with the intermittent fasting, like with women's hormones, we need to eat breakfast, like, you know, kind of within an hour or so of being awake. We need nourishment coming in, whereas men can kind of get away with not eating for a few hours. Again, because our hormones are totally different. So, yeah.
For sure. Absolutely. So if somebody wants to work with you, how do they do so?
If they want to work with me, they can. I have a link on my Instagram bio that you can schedule a consultation with me, or you can send me an email at tdnutritioncoaching@gmail.com and we can set up a consultation.
Yeah, and if you're one of my followers listening to this, go to Taylor's site. It's TD_nutrition, TD_nutrition on Instagram. There's a link under her bio where you can schedule a consultation wherever you live. She's a phenomenal health coach, and in particular on how to balance your hormones, how to create a nutrition plan from an eating plan that's right for you. And even though she's a crazy vegetarian, she's not married to that if eating meat is something that you enjoy and feels good for you.
Yeah, definitely. I won't tell you not to do it if you want it. So, yeah. So are you excited about RFK potentially being, nominated for?
I know. I hope he's confirmed. I am. So Health and Human Services, which is the position that he's nominated for and hopefully will be confirmed, is a huge organization. It's an umbrella organization under which sits the CDC, Centers for Disease Control, the FDA, the Food and Drug Administration, the NIH, National Institutes of Health, which funds almost all the research that's done in our country, and the Centers for Medicaid and Medicare. So it's a very important position. I don't agree with all his stances, especially on some of the social issues. He was a proponent of single-payer healthcare in the United States. Of course, he's very pro-choice on the abortion issue. I don't agree with him on that. But I think he's spot on understanding the corruption of these three-letter agencies, understanding that the vaccine industry is completely broken and that the pharmaceutical companies should not have liability protection for these products. And he's completely right about the suppression of free speech, the use of alternative medications like ivermectin, et cetera, to treat COVID. Now we're using ivermectin even to treat cancer. So, boy, I hope he gets confirmed. And I think it is so important that we get him in that position to start reforming these organizations that should work for the American people, not work for the pharmaceutical industry. And the CDC and the FDA, about 50% of their funding comes from the pharmaceutical industry. And we need to stop that. We need to also put those agencies under the direction of people that were elected by the people, not people that are just, lifelong bureaucrats working for the administrative state. So, yeah, I'm optimistic, but we'll see. But at the end of the day, I don't really care what these agencies do. I care what individual citizens do, what people do, learning how to optimize their own health, learning how to read labels, understanding what informed consent is, regardless of what the government tells us.
Yeah, absolutely. Do you think he'll be able to get fluoride out of our water?
Well, I know there have been some states, I think in Florida, Governor DeSantis has removed fluoride from the water. It's crazy when you look at the history of how fluoride got into our water. I think it is so unhealthy. But again, I don't want bans. I want individual municipalities. I want individual states to make those decisions. And most importantly, I want citizens to understand it. Even if we remove fluoride, I still don't want people drinking tap water.
Right.
If you've ever repiped your house and you look at those water pipes and you look inside of them, the junk that's in them that's collected over the years, disgusting. Tap water is perfect to flush your toilet with, but not to put in your body.
Yeah, exactly. So yeah, it'll be cool to see. And like you said, it does boil down to what individual citizens do, because we just need to have the awareness, and I think the average American doesn't have the awareness. So I'm hoping that there can be more awareness, because people don't realize how unhealthy food is. Like, people might get McDonald's and like, oh, it's not that bad, but it's like, do you realize how bad it is? Do you know all the ingredients and what these are doing in your body? Because most people don't.
Well, listen, it's happening just naturally. I mean, look, I'm looking at your Instagram post. You've got over 120,000 followers. My Instagram is growing. Yours is growing. People like us, our following is growing. There's a hunger out there for the truth and for a perspective on holistic health. I'm going to be starting a radio show soon called Optimizing Your Health.
That's cool.
It's going to be an hour-long show once a week where this is all I'm going to do is talk about this. I want to talk about cholesterol and the myth of cholesterol and cardiovascular disease. I want to talk about why birth control pills are so harmful, breast implant illness. I want to talk about all these things and have it spread, and I'll have you on as a guest for sure. Or we'll get TD Nutrition as a sponsor of the show or something. I don't know.
Yeah.
But there's a hunger out there, and there's, I think, a growing community of crunchy people that want to learn more, and it's spreading far and wide, and we don't need the government to help us with that. It's growing just naturally because you and I and many, many others are speaking out.
Yeah, definitely. Well, you mentioned cholesterol, and that is one of the things that I want to talk to you about. Let's talk about cholesterol and why it's not as problematic as we once thought it was, and the whole issue with statins. Because I even recently had a client come to me and she was like, my doctor put me on, a statin for my cholesterol because it was so high. And I was like, oh my goodness. So I kind of briefly shared with her what to keep in mind.
Sure. Yeah, I think we've been misled. Statins are things like Lipitor and Crestor. Statins are $1 trillion industry in the United States. It's the #1 prescribed drug in the entire world. Yet, despite the fact that over 50% of all adults are on a statin, cardiovascular disease remains the #1 killer in the United States. So how could that possibly be if so many people are on a statin and their cholesterol is low? Well, if we went over to a local hospital and pulled up their medical records and looked at the last 100 people that had a heart attack that showed up in the emergency department, what we would find is 50% of those people have perfectly normal cholesterol levels, but they yet showed up with a heart attack. What we would also see is everybody that showed up with a heart attack has some level of metabolic dysfunction and inflammation. So cholesterol is not the cause of cardiovascular disease. Cholesterol, in fact, is protective. So I've heard this analogy, I can't remember by who, that cholesterol shows up at the scene of the crime, but it's not the cause of the crime. So it would be like if you walked down the street because somebody's house was on fire and you stood out there and you noticed the firemen and the fire trucks that were fighting the fire. And then the next week you saw another fire and the same thing. You showed up at the fire and there were firemen and fire trucks, and you concluded that the firemen were causing the fire. No, the firemen show up at the scene of the crime to put out the fire. Cholesterol shows up at the scene of the crime, inflammation, metabolic dysfunction that's causing your arteries to be closed, and the cholesterol shows up there to try to protect you, not to be the cause of the crime. So in fact, there are studies that show that the higher your cholesterol is, the less likely it is that you're going to die from cardiovascular disease, and the less likely it is that you're going to have Alzheimer's disease or dementia. So the problem is we put you on a statin, we artificially lower your cholesterol, and by the way, cholesterol is necessary for the production of just about every hormone produced in your body, including in men testosterone and in women estrogen. So it's no wonder I routinely see guys 50, 60 years old that have below normal testosterone levels because we beat up their cholesterol now for years and we're doing them a disservice. So it's inflammation and metabolic dysfunction and toxic exposure that causes cardiovascular disease, in my opinion. And it's not just my opinion, there's a growing group of cardiologists that believe the same thing and no longer use cholesterol lowering medication. So I robustly measure inflammatory markers and metabolic markers and then aggressively treat those and try to detoxify people. Stop putting fluoride in your mouth in the form of toothpaste. Stop drinking toxic government water. Stop putting aluminum under your arms in the form of antiperspirants because that's toxic as well. Stop putting all these chemicals and perfumes on your body that are endocrine disruptors and cause all kinds of problems.
Yeah.
So that's my approach. I no longer prescribe statins or cholesterol lowering medication to my patients, and the ones that are on them, I try to get them off of them because I think they truly cause more harm than good. Now, I'm not here on Taylor's podcast telling you what to do from a medical standpoint. I'm not trying to diagnose or treat any medical problem. Always check with your own doctor and do your own research. But there are a lot of cardiologists out there like Dr. Jack Wolfson, who has become somewhat of a mentor, natural heart doctor, board certified cardiologist. And he agrees, or I agree with him, that cholesterol is not the devil. It's inflammation and metabolic dysfunction that starts off as how we take care of ourselves, primarily with nutrition, and then the toxic exposures that we have as well. So learn how to optimize your own health by following people like Taylor, myself, and others, and just get a little bit better than what you are, and you'll see dramatic improvement in a lot of measurable outcomes as well.
Yeah, definitely. Yeah, I think the cholesterol topic is so fascinating because, I mean, again, and granted, like, you as a physician are in such like a, special corner because a lot of doctors aren't with it, and they would probably then be like, oh no, that's wrong. You still need to do this with cholesterol. But I think that clearly that hasn't helped because the problem's not really much better. So I think it's great that you're shedding light on that and bringing awareness that there's a different way to look at this.
And if cholesterol was the devil and everybody and their mother is on a cholesterol lowering medication, why is cardiovascular disease still the #1 killer in the United States? I've had this conversation with some of the pharma reps that make the cholesterol lowering medications. They say, well, the problem is we haven't set the bar high enough. We need to lower people's cholesterol even more than what we've currently been doing. Of course, now all the cholesterol medication is generic. So do the companies celebrate that it's less expensive? No, they come out with the next generation of cholesterol lowering medication called PCSK9 inhibitors. Probably the poster child is a product called Repatha. It's branded only, it's thousands of dollars a month, and now they're pushing this to further lower cholesterol. And it's a problem, so all I can do is educate, treat my small world of patients that come to see me in my practice and follow me on social media, and that's all I can do. And hopefully the word is getting out, and more and more people will start to learn how to optimize their own health.
Yeah, exactly. And kind of break out of the like big pharma cycle that we get stuck in. Like, you get like a COVID vaccine and now there's like these turbo cancers, and so you're stuck in this big pharma loop because you take a product which then leads you to some type of side effect or illness where then you have to take more big pharma products, and so you just kind of have to break yourself out of the cycle. And
100%. Taylor, I'm seeing more cancer patients than I ever have in my career. And women's health is huge. I no longer recommend women get annual mammograms. I've stopped doing that. It doesn't make sense to me anymore. Instead, I'm using thermography and then ultrasound or MRI technology. There's a hunger out there, truly, for patients wanting a different approach to healthcare. They're sick and tired of our traditional healthcare system that I think is failing patients. And there's a growing group of providers of care, you included, that are just exploding because there's patients that want something different. They want to learn how to eat. They want to learn how to take care of themselves. They want to know what screening tools actually make sense. And they just want to feel good and ideally live their life as disease-free as possible.
Yeah, absolutely. And early on, you mentioned how you kind of realized that you've, a lot of what you learned in medical school was wrong, and that you've had to like reframe and relearn a lot of things. Did you learn any nutrition in medical school? Like, did they teach anything about nutrition?
Sure, about 5 minutes worth. So we learned about some of the, extraordinarily rare nutrition deficiencies like scurvy with, the British sailors that didn't have any citrus and they developed scurvy, or, beriberi, like these really weird things that you just don't actually see. We were taught that saturated fat is bad for you, that you should eat the white of eggs and never eat the yellow of eggs, that you should avoid red meat whenever possible. Those are the things, the traditional things that we were taught that just simply are not so.
Yeah.
Healthy saturated fat is so healthy for you. We should not be avoiding it. We should be cooking with butter and lard.
Yeah.
We should not be cooking with seed oils and vegetable oils and canola oil. That stuff is toxic.
Yeah.
Avocado oil, yes. Olive oil in small amounts, as long as it's not at high heat.
Yeah, it's really meant to be heated olive oil.
No, it's not. It's not. And people will cook with olive oil. It's great for sauces and dressings, but not to actually cook and heat up. So, in my refrigerator, I've got grass-fed raw butter. That's what I cook with most of the times. It's delicious. It's easy.
Yeah.
And it's so much more healthier than spraying canola or vegetable oil in your pan before you cook up that grass-fed, grass-finished organic ribeye.
Yeah, definitely. But it is crazy how little they teach nutrition in medical school. I think the statistic is like 80% of medical schools don't teach any nutrition at all.
Yeah.
And the other one too that clients will come to me with a lot is like, well, my doctor told me to stop eating fruit because of the sugar. It's too much sugar. And I'm like, but it's not the same. It's not the same as processed sugar. And it's so hard because then they will get on them for, like, I had a client recently who the doctor was like, oh, what are you eating for breakfast lately? And he was like, oh, I eat like 5 bananas. And the doctor was like, what? 5 bananas? Like, that
Right.
woke me up in the morning. Because we're so, like, I feel like we're so conditioned even to be afraid of fruit because of the sugar. And
Sure.
so it's like 1 banana is enough. But it's like if you actually wanted to have a meal of fruit to fill you up, 1 banana is not going to be enough. You need to have more. But people are so afraid because of the sugar, because many doctors lump it in the same category as all
They do, yeah. The sugar that comes from fruit is not the same. First of all, there's fiber associated with it, which immediately reduces the absorption of the sugar. I never limit patients' fruit intake. I mean, I don't think somebody should be eating, 25 oranges. But listen, they'll drink a glass of orange juice.
Yeah.
And, yeah. And so how many oranges does it take to fill up that mason jar that you're holding up with orange juice? I don't know, but a whole bunch of them.
Yeah, like 20. This is mandarins, though, so it's like 20 mandarins. So they're
So what I tell patients, eat the fruit.
Yeah.
Don't just drink the juice. I mean, it's fine. I love fresh squeezed orange juice.
Yeah.
But eat the fruit. Eat an entire orange or two. Eat an apple, ideally organic. Have a banana.
Yeah.
Berries are so healthy for you. Blueberries and strawberries and boysenberries and blackberries are so healthy for you. So eat more fruit for sure. Fresh organic produce, definitely. I limit some vegetables that I eat. I don't eat a lot of vegetables, in part because of laziness and in part because some of the phytochemicals and oxalates and lectins that are in there, I'm not sure are particularly healthy. But eat naturally. Eat food that God made, not that man made. If you think about it from that framework only, I think you'll be healthier. As you're walking down the supermarket, all the stuff that's around the edges of the supermarket typically are healthiest. The stuff that's in the middle that comes in boxes and cans and so forth, not particularly healthy. Organic whenever possible. Farmer's market, if you have one available, that's always best. So, we need to take better care of ourselves, reduce our stress, get better sleep, spend more time in nature, not behind our desk and our computer screens.
Yeah, absolutely. And it's crazy doing all of those things. You don't then need all the pharmaceuticals.
100%.
It's very simple, really. When you like break it down, it's not that difficult.
Yeah, for sure.
Yeah.
Absolutely. I couldn't agree more.
So kind of one more question that I have is when you went through, like when you started really speaking out, did you lose patients? Did you lose friends? Was there a kind of like a growing pain period where people were like, okay, what are you talking about? This is ridiculous.
All of the above. I lost patients They didn't like what I was saying. They believed it was based on a political message when it really wasn't.
Yeah.
Sure, I lost some friends that stopped talking to me because they thought I was out of my mind crazy, telling people that they should not get COVID vaxxed. They should not, excuse me, even be tested. They shouldn't put that ethylene oxide sterilized Q-tip up their nose and so forth.
Yeah.
But shortly after, a few months went by and the floodgates open. Now I've got a waiting list to get into my practice. I see 1 or 2 new patients a week. And there's been a complete reversal.
Yeah.
I'm lucky. My MD degree gives me some credibility. It shouldn't, because most of what I know now from a holistic health has nothing to do with the degree after my name. It has everything to do with the independent research that I've done, following people like you and others that have taught me about nutrition and holistic health. So my practice is as busy as it has ever been. Actually trying to, if you're listening and you're interested, I'm looking to hire a new physician that's like-minded, holistically oriented. They're very, very hard to find. We are a unicorn out there. So if you're listening to this and you're one of them, give me a call, private message me. I'd love to meet you and have you come over and see what I do and maybe hire you as a new physician.
Yeah, that's great though that you're growing that much that you do have a need for another physician. And I think that's the future, is having medical practices like yours that are more open-minded and use more holistic perspectives and modalities in conjunction with prescriptions, because sometimes you do need a medication here or there. Like I actually saw your PA back in January, but I had a urinary tract infection, had one in 10 years, and I had to be on antibiotics. And I was like, I haven't been on antibiotics in 6 years.
Yeah.
It was so disappointing. But like, obviously sometimes things happen and you have no choice. So,
Sure.
there's a time and place, but most of the time, it's nice to have someone to guide you with, the more holistic approach.
Yeah, 100%. I could not agree with you more. I'm not anti-pharma. I think pharmaceutical products should be used very limited.
Yeah.
I try to avoid antibiotics whenever possible. Always give an opportunity to allow your immune system to fight off infections and to treat it holistically with a whole bunch of holistic hacks, whether it's whole food, vitamin C and elderberry and zinc and garlic and so forth. But occasionally it's needed. Occasionally antibiotics and other medications are needed. I'm not opposed to that, but not as a first-line treatment.
Yeah, absolutely. And I think that's so important because, similar to birth control, so many physicians just like prescribe antibiotics like nothing, like it's no big deal. And I've had friends who are like on antibiotics every couple of months for another infection. And I even look back to when I had Lyme disease. The fact that, and what's crazy is I was working with a naturopathic physician and she put me on antibiotics for 10 to 14 months. We were 2 weeks
Wow.
on, 1 week off. And I was like, how? I mean, that just doesn't logically make any sense. And it's like, no wonder I wasn't any healthier and I was like worse off at the end of all of
For
it.
sure.
So.
Yeah, I'll tell you the next topic, maybe this is for another podcast, is talking about parasite cleanses. And I'm convinced that a lot of people with Lyme disease, chronic Epstein-Barr virus and so forth, often it's because their immune system is dysregulated because they have parasitic infections that need to be cleaned out of their body. So
Yeah.
I'm a big proponent if somebody is not feeling well, especially if they have gut problems, and I can't otherwise figure it out, that I will institute some sort of parasite cleanse for them to try to get them better.
Yeah. Parasites are a big topic. I mean, there's lots of trendy parasite cleanses out there, but there's like a lot of effective ones as well because they are super problematic. And then what's crazy though is after you take antibiotics, a lot of times you're more at risk for getting parasites.
100%. Absolutely.
Yeah. Well, awesome. Well, to wrap it up, I have some fun rapid fire questions for you.
Okay, let's go.
My first one is, what is your go-to breakfast?
My go-to breakfast is sourdough bread with nutso. Nutso is a non-peanut multi-spread with a little drizzle of raw honey. That's my go-to breakfast.
Awesome. Yum. And what does your morning routine look like? Like everyone has very specific morning routines. I feel like especially if you're health oriented, you have a very specific morning routine.
I'm very blessed because I live about a half a mile from the ocean, so I often run in the morning. I love running. I will run. It's about a 4-mile loop. 2 miles in, I'm at the beach. I take my shoes and socks off. I will ground for about 10 minutes. I'll actually walk into the ocean to get my feet exposed to salt water for grounding. I'll put my shoes back on and complete my track. I will, in the middle of it, there's this nice little Corona Del Mar kind of ledge, and I will do 100 push-ups. So I'll run, I'll do push-ups, I'll come back. This is before breakfast, and then I'll make myself either eggs or my sourdough bread, or I'll make a protein shake. I'll put creatine and whey protein, a banana, usually blueberries, and a little bit of raw honey, and make a protein shake. That's my kind of my morning routine. I have a infrared sauna that I use almost every night now. It is fan-friggin-tastic.
Love the
I don't do cold plunges because I'm not man enough to do that. I bought myself a cold plunge, by the way, and I used it once.
Yeah.
I'm like, oh, hell no, I'm not doing this.
Yeah.
So I've never used it. I actually gave it to my office administrator, and she uses it. So I haven't quite stepped up that routine yet.
Yeah.
But that's kind of my routine. There's a gym that I work out with. I'm an old guy, but I do kickboxing. It's a great workout, and I'm kind of learning a skill mixed in with weightlifting. So that's sort of my exercise and my morning routine.
Awesome. That's amazing. Yeah, the ice bath, that's hard. It is hard.
It's brutal,
Man or
I
woman,
know.
but it's hard. Yeah.
For sure.
What's your favorite fruit?
I like berries for sure, blueberries. I always have blueberries in my refrigerator. I always have apples because they're easy and they last forever, both of which are organic.
Yeah.
I love oranges as well, so those are probably my favorite.
Awesome.
Summer fruits, of course, apricots and peaches and nectarines, fantastic.
Yeah. Awesome. Yeah, and right now oranges are in season. We're in citrus season.
For sure.
Yeah. How do you de-stress, like after a stressful day?
Oh boy, not enough. I think running and grounding is my main way. I also try to read the Bible every night, sometimes in the morning. So that's one way. In my bedroom, I don't have a TV.
Yeah.
I don't plug my phone in there. I have a clock radio that's battery operated. It's not plugged in. I've got a Beamer mat, which is
yeah, I love Beamer.
I can't remember exactly how it works. So I lay on my Beamer mat, I read the Bible for about 15 minutes.
Yeah.
That usually makes me tired, and then I go to sleep.
That's awesome. That's so crazy. Yeah, there's an acupuncturist in my area, and she has Beamer, and so when I was going through Lyme, I did it all the time. It's amazing.
Yeah.
Yeah. And then what's your go-to supplement that you can't live without?
There's a couple.
Okay.
First of all, I think supplements should be individualized based on blood tests and whatever your personal needs are and symptoms are.
Yeah.
But there are a couple supplements I think most people would benefit from. One is high-dose purified fish oil and or cod liver oil. I take both, so I think that's important, and most people would benefit from that. The other is, you may not agree with me on this, but a beef organ supplement.
Okay.
So there's a product from Designs for Health that is liver, kidneys, pancreas, heart, and spleen. Organically sourced from New Zealand, regeneratively grown beef organs. Most people won't eat organs because it's disgusting. So I take a beef organ supplement. That's my whole food equivalent of a multivitamin. And then zinc. Many people are deficient in zinc. The zinc I like is called oyster zinc. It's literally from oysters. The reason why I like it, it's got the cofactors that are necessary for absorption, including copper, selenium, one of the B vitamins, and I think something else. It's low dose. So those are my go-to supplements.
Awesome. That's great. And then my last one is what are you most hopeful for about the future when it comes to health and wellness?
I think that voices like yours and mine are not suppressed, that we have a growing audience to teach people how to be healthier and how to live their best lives.
Yeah.
Recently, every Monday on my Instagram, RX for Liberty, I am recording a faith message. It's called Morning Faith Message, because I'm realizing, Taylor, the purpose for being healthy is not for the sake of being healthy. It's nice to be healthy, and I want people to feel good.
Yeah.
But the purpose isn't for the sake of being healthy. In my opinion, the purpose of me teaching people how to be healthy is so they can serve whatever God's purpose is for them in their life. That's what I want. And so that's why I started incorporating a faith message once a week, because I want people to realize I don't actually care whether they're healthy or not. I want them to be healthy so they're in a better position to serve whatever God has in mind for them, whatever their purpose is in life, so they can do a better job for a longer period of fulfilling whatever that purpose is.
Awesome. That's great. So yeah, if you guys don't follow Dr. Barke, you can follow him on Instagram at RX for Liberty, and he posts a morning message every day on a different topic, and you go even more in depth for your subscribers, correct?
I do. I've got a subscriber platform on both Instagram and on Telegram. I can't remember. It's like $5 or $6 a month or something like that, and you can interact directly with me. I answer questions there as well. It's a lot of fun. I really enjoy it.
Yeah, that's awesome, and that's great. I think that's what people really need. So yeah, if you're not following Dr. Barke already, you should definitely go follow him. So.
Well, thank you.
Well, thank you so much for doing this. I'm so glad I finally got to have you on, because I've definitely wanted to pick your brain and have you share some of your perspective. So.
Absolutely. Thanks for having me on. I hope your podcast does great. I know we've done an Instagram Live together. We should probably do that together again. That was a lot of fun.
Definitely. I think that would be great. Yeah.
All right, cool. Thanks, Taylor.
Thank you.